1 in 20 people are hit by heartburn when they're on their Mounjaro and Wegovy. I'm Zeinab, I'm the pharmacist from PillSorted, and I'm going to review what heartburn is, why does it happen, what are the things that stack up and make it worse, and what's the best way to treat it. Why does it happen? Reflux happens when this tiny ring muscle that's right at the top of the stomach, it lets the acidic material come up and hit the food tube or the gullet, okay? Because it's so acidic, the stomach is full of really strong acid to be able to digest and make the food really tiny parts. But when that comes out of the stomach, you get that feeling of really sour and bad taste in your mouth. It really burns. It's very uncomfortable. If it happens too many times, it makes that gullet or the food tube become scarred, and that scar tissue makes it harder to swallow. It causes a lot of digestion problems. Why does it happen with the GLP medications? How Mounjaro and Wegovy or the GLPs work is they slow down the digestion. When they slow down the digestion, food stays in the digestion for much longer. So it takes it longer for the stomach to digest, and that longer time causes it more likely to come out. I want to say both ways. Losing weight actually really helps relieve heartburn as well. So if you're overweight and you have too much food, it is more likely that it comes out of the stomach area and makes the heartburn happen. But when you're on the GLPs as well, you have to do a couple of things to be careful that you don't get too much heartburn. Okay, so for example, if you have too big of a meal suddenly, or if you have too much of a heavy fatty food, these take much longer for your digestion to deal with them and that's why they can cause more heartburn on the GLPs. The reason that I talk so much about the stomach issues that's happening with the GLPs is 70% of the side effects are stomach related or gastrointestinal versus 47% on placebo. Okay, so that's why it's important to talk about all the different things that can happen on your digestion when you're on the Wegovy and Mounjaro. So we talked about how it feels. So you've got this bad taste in your mouth, you feel like a burning sensation right on top of your stomach in between breastbone. But if this pain becomes really like a crushing chest pain or it spreads out onto your shoulders, it might be something else. So it's good to get it checked. Okay, so what are the things that can stack up and make the heartburn much worse? One is medicine side. So some medications like the NSAIDs, like ibuprofen, like naproxen, these can cause inflammatory in your digestion and they can make your heartburn worse. Also things like the blood pressure medications, the calcium channel blockers, amlodipine and nifedipine, they can relax the smooth muscles and sometimes they make the heartburn worse. The bisphosphonates, like the alendronic acid, risedronate, these are given for bone protection and they're usually once a week dosage, especially in premenopausal and menopausal women. They're very sensitive too, so you want to have them on a with a full glass of water and you need to sit up so they don't affect your acid reflux. Some antibiotics. The tricky thing about antibiotics is they're very time sensitive, right? So you have to take it 3 times a day, you have to take it 4 times a day, and sometimes those are very close to our bedtime. The worst thing that happens is you take an antibiotic and you lie down. When you lie down, it doesn't get down right into your stomach. It might start opening up before reaching the stomach. It can cause a lot of pain, okay? Or even if it gets to your stomach but it's not digested enough, that can cause heartburn as well. And any other medication that might slow down the digestion, like the opioid painkillers or any other painkillers that slow down the digestion, they can cause reflux and becoming a little bit more. From the supplements, things like fish oil, omega-3 or apple cider vinegar, fat burning supplements, these can have an effect on how the digestion, how the stomach works, and they can make heartburn get worse. Okay. Other things are like having too heavy of a meal too late in the night, or alcohol, smoking, vaping as well. These can cause digestion issues. So how do we treat it? There's lots of different things that we can do to support and relieve heartburn. One of the first steps is actually drinking a little bit of water. Water can help neutralize the acid and it will help everything go down again. Now, first line is things that neutralize the acid, like these calcium carbonate. So this is the things that can neutralize the acid in the tummy. And then there's things like alginates. So the alginates make a raft on top of the food, so they won't let the acidic content hit up and get out of the stomach, okay? Things like Gaviscon and tablets. There's also these Pepto-Bismol, so it's got the bismuth salicylate, and that can do the same. These are usually short term, but you can have it a couple of times per day. So after food, especially if you've had a heavy food, greasy food that you're not used to, it's okay to take them, okay? So it'll help, and it is effective after food as well. Now the next line is the proton pump inhibitors, as it's called. So what they do is they affect the amount of acid that's produced in your stomach, okay? And you can have like esomeprazole, lansoprazole, omeprazole, all of these, they help by reducing the total amount of the acid that your body creates. It takes a little while to build up and work effectively, and it's better to take it before food, okay? So if the heartburn is becoming something a little bit more recurrent, the next line would be using these. You can have a short dose of it over the counter. If it was effective, you can ask your doctor to check in and have more. Having said that, there is a certain bacteria called H. pylori that are one of the only bacteria that can survive in such harsh environments like the acidic stomach, but they can cause more acid to be produced. So if you feel it is becoming recurrent, it's a good idea to ask the doctor to check for the H. pylori for you, and it's quite easy. So you blow into the device and it will tell you if you've got H. pylori, or there's different ways. Anyhow, it's good to check for the H. pylori. This is the next line, the proton pump inhibitors. In addition to that, again, there's some more medication, things like famotidine. So famotidine helps reduce the amount of acid, and they can be added to the rest of the medications. And for lifestyle, smaller meals, not close to your bedtime, plenty of liquids, these can help. Another important thing is the dosage of your GLP medications. If you feel that when you've moved up a dose, you're getting more side effects like heartburn, like bloating, like too much of an appetite suppression, definitely we need to adjust that dose. So there's no rush to go to the higher doses too fast, okay? What's the reset? First, smaller meals, okay? Don't go too hungry, don't go too full, but smaller meals, not too close to bedtime. The other one is don't lie down straight after eating. And then there are lots of different things that you can buy over the counter, and check what you're having from medication and supplements. If you need any help about which ones to add, which ones to stop, reach out to us. We can review all of them for you, okay? One other addition that I want to make, bloating and feeling like trapped wind, these are very close cousins of heartburn, okay? So when the digestion slows down, it does make the food have longer time to ferment in the digestion, and fermentation is what causes the extra gas. Okay, there are lots of things that could help with both of these. For example, peppermint tea, like or Windies or Simeticon. These can all help relieve that gassiness as well. Plus fiber. There's different kind of fibers. Some of them are better and cause less gas. Some of them make more gas. If, for example, you've started fiber gummies and you feel more bloated, you can try using fiber gel. Now, if you feel that this bloating, this pain, this heartburn is just getting out of control, it's getting worse and worse, definitely let's get it checked, okay? So you can take breaks from your GLP until your digestion settles down. We can support you with doing the right dosage and right treatment. So around the 2 weeks, 1 month mark is when you do need to think about and look at things more seriously. If it still carries on, or if it feels really worse, that's affecting your life, okay? As a recap, heartburn is one of the side effects of the GLP, and there are lots of different things that we can do. And sign up to our channel. There's lots of good advice here that we can support you with the weight loss treatment and handling the side effects. Thank you.